Ladies and gentlemen, thank you. It gives me great pleasure to introduce to you the Chairman of Avant Mutual Group, Associate Professor Stuart Boland.
Thank you, ladies and gentlemen. The time 5:30 in Sydney. I declare the 2013 Annual General Meeting of the Avant Mutual Group open. And note we have a quorum, as there are more than the required 20 members present, in person or represented by proxy. I note that this meeting is linked by video and telephone to our interstate offices, and members can watch the AGM via the live webcast of the meeting. So I welcome you to the 2013 AGM of the Avant Mutual Group. I extend a special welcome to the current voting members of Avant Mutual, in addition to myself being Professor Simon Wilcox on my right at the end of the table. Beverly Rowbotham is rung in by telephone. Rosemary Aiton, Jonathan Burden, and I believe Stephen Clark are all in the Melbourne office. I also welcome...
Sorry, Stuart, Stephen Clark has an apology. Stephen's an apology.
Well, I welcome Steve when he gets in, or if he does a bit later anyway. Well, thank you. I also welcome the non-member directors of Avant Mutual Board, Vin Tozer and John Fay. Dr Cheryl Hurst, though, is not with us this evening, having resigned from the Avant boards during the year. But I'd like to acknowledge her very significant contribution to the organisation. Cheryl served on the boards of UMP and Avant for a total of 10 years, bringing with her a wealth of both clinical and commercial expertise. And I know I speak for all my fellow directors in expressing our deep gratitude for her service to the organisation. And I'd like to take this opportunity to introduce to you Andrew Balderman. He's sitting on my right, and he was appointed as CEO of the Avant Mutual Group in August of this year. He is also a director of the Avant Insurance Board. Welcome, Andrew, after 80-odd days to your first Avant Mutual AGM. I also welcome other members of the Avant Insurance Boards who are here today. I draw your attention that Duncan West has recently joined the Avant Insurance Board and brings a wealth of experience, having previously held senior positions at NAB and IAG. Unfortunately, though, Duncan couldn't be with us this evening. However, I'd like to express that we are delighted to have Duncan on the Avant Insurance Board. I welcome our external auditors, PricewaterhouseCoopers, represented by Scott Hatfield here in Sydney. Scott has been the external auditor for Avant for the last 5 years, but retires by rotation after this AGM. Scott, and I just do want to say at a personal level on behalf of all the directors, and I guess even beyond that to the staff and all the members of the organisation, of just the sterling work you've done. And at a personal level, I'll miss the friendship, but hope we keep in touch. And next to you is Scott Ferguson, who will be replacing you. Scott, you have big boots to fill, and we're confident that you will do that. We also welcome Jefferson Gibbs. Where's Jefferson? Our appointed actuary and partner at KPMG. Deborah Pittman of the Election Consulting Group have assisted us both in the conduct of this meeting and the election of voting members by providing postal and electronic voting services. Thank you. And our scrutineers for the election of the voting member directors, Ernst & Young, represented by Mr Craig Jackson here in Sydney. And finally, I'd like to place on the record the gratitude and the appreciation of the Avant board for the work of Mr David Nathan, who resigned from the Avant Mutual Group earlier this year. David was the inaugural CEO of Avant, having joined the medical indemnity industry with United Medical Protection, which merged with the Medical Defence Association of Victoria to become Avant in 2007. Under David's leadership, the organisation grew in strength, both in terms of our financial position and also as an organisation. Net assets of United Medical Protection at the 30th of June 2006, just after he arrived, was $348 million, with the net assets of the Avant Mutual Group growing to $840 million that we report today. He was a very dedicated CEO, and given that he left us in May this year, he is in large part responsible for Avant's performance in 2012-13. And we'd like to record our thanks to David for the excellent contribution that he has made to Avant. I come next to apologies. We have apologies from Penny Brown, Dr. John Campbell, Dr. Annette Carruthers, Dr. Michael Fogarty, Dr. Gaydon Howe, Dr. John Ullman, Dr. Deborah Veran, and Dr. Milorad Sokolovic. Are there any other apologies that need recording? No other apologies? Thank you. Come now to standing orders. I confirm that the standing orders, which were approved by the members at the 2008 Annual General Meeting and which set out the procedural rules for this meeting, are available for inspection at each of the officers participating in this meeting, should anyone wish to inspect them. And now I would first like to deal with the minutes of the Annual General Meeting of 2012. These are available for inspection at each of the officers participating in the meeting, should anyone wish to inspect them. May I have a motion that the minutes of the Annual General Meeting of 2012 be adopted as a true record of that meeting? I have Linda Satchwell proposing the motion.
Seconded by Rosie Aiton in Melbourne.
Seconded by Rosie Aiton in Melbourne. I think that motion is carried. Now, the only formal business of this meeting is the receipt and the consideration of the financial statements for the year ended the 30th of June 2013. There will be an opportunity for questions and comments in relation to the financial statements and to any items of general business. And the results of the 2013 member director election will also be announced. So before moving further, I'd just like to make a few remarks. And I would like firstly to take this opportunity to say how proud I am of our achievements at Avant over the last 12 months. Avant plays a very important role in the underpinning of healthcare in Australia. Avant members play an integral role in the provision of high quality health services to our community right across the country. It's Avant's role to serve, to support, advise and assist members as they face the opportunities, challenges and responsibility of providing care in a system that has ever increasing demands. I will assume that members have read the Chairman's report set out in the annual report, but I'd like to highlight some of the results and the achievements to the last financial year for the Avant Mutual Group. We've continued to ensure that the foundations of the business are strong by improving our financial position, with net assets increasing from almost $725 million at the 30th of June 2012 to $840 million as at the 30th of June 2013. I also remind you that we now support over 60,000 healthcare practitioners and students, and we have a member retention rate of over 98%. Avant's loyalty reward plan provides rewards for eligible members ranging from 6 to 15% of their annual premium. That plan now offers rewards over 4 categories and is increased a further 10% when a member also holds a Doctors' Health Fund policy. The Doctors' Health Fund has increased its membership by 11% during the financial year, the second highest growth rate of all health funds across Australia. We've increased the number and dollar value of our research scholarships for doctors in training to $300,000 for 8 scholarships in the last year. And Avant has committed over $1 million over 5 years to support the Ear Science Institute of Australia in Perth, and we continue our important investments and partnerships with Cerebral Palsy Australia and with Interplast. We have ensured that members' voices are heard on important regulatory issues, such as the Victorian Government's inquiry into the performance of APRA, the Senate's inquiry into the National Disability Insurance Scheme, and more recently to changes in the industrial relations framework in Queensland. And Avant will continue to advocate and engage with policymakers that affect members. A major innovation in our work to assist members with managing their risk was the introduction of the Avant Risk IQ CPD portal. Members can now assess 8 different e-learning courses, all with CPD points, a library of webinar medico-legal risk recordings, and videos of more than 10 case study discussions. And very importantly, Avant has protected the reputation and livelihoods of numerous members through the great work of our legal and claims teams. So this has been an excellent year for Avant, a year in which we celebrated our 120th anniversary. And the board will continue to provide prudent management and member retention and growth to ensure that we continue to support the great work of our members into the future. So with those remarks now, we come to the formal business of the AGM as set out in the notice of the meeting that's been sent to members. Item 1 on the agenda is to receive and to consider the financial statements and reports for the year ended the 30th of June 2013. Our Chief Financial Officer, Scott Pearson, is with us in our Sydney office. Our external auditor, as I mentioned earlier, Scott Hatfield, is also here and are prepared to answer any questions in relation to the financial statements. So, are there any questions or comments in relation to the financial statements to be directed to myself, Mr Hatfield or Mr Pearson, from members in Sydney or in our other offices in Melbourne, Brisbane, Adelaide or Perth?
Well, Mr Chairman, you sent out an annual report, but there isn't any financial statements in it.
I can make sure you get the financial report for the year too, and don't grizzle at me when you see it runs to 50 pages. And I think we'll pass one to you right here now, John. Any other observations or questions? So, may I have a motion that the financial statements and reports be received and considered?
So propose.
Proposed by Professor Simon Wilcox. Anyone seconding the motion? Who's that?
Jonathan, Melbourne.
Jonathan Burden seconding the motion. And I declare the motion carried. There are no items of general business included in the notice of meeting. However, if any member wishes to raise a question or make a comment appropriate to this forum, this is the opportunity to do so. I would ask members to confine themselves to 1 or at the most 2 questions or comments and confine these to a maximum of 5 minutes. So, are there any questions or comments from members here in Sydney or Melbourne, Brisbane, Adelaide or Perth?
Stuart, the first question is the last medico-legal report I started in about 2002 for the defence, this medical defence union. We eventually had an expert overseas person from England pontificating for the plaintiff. Have we been able to get rid of this sort of garbage legal opinions now to something who is local and knows what's going on in a Sydney suburban hospital in the early 90s?
Oh, I think, John, across the organisation, both internally and externally, We've got plenty of local experts that are able to reflect on the situation here. We certainly, this year, we did have an overseas visitor, Gerald Hickson, but he was advising us of a very innovative scheme in the United States of just how the profession ought to conduct itself, whether it be in hospitals or other groups, and done in a way that is effective, takes the regulators largely out of it unless there are issues of interest to the regulator, and so at least for people of my age, a magnificent innovative idea where the medical profession meets its true professionalism by being responsible for its own conduct.
What worries me about my College of Obstetricians and Gynecologists is that they want people in active practice to still be on their medico-legal panel. But as you know, some of these cases come up many years ago when the people who pontificate as professors were still in napkins, and this is what worries me, is that because they're professors, the judges seem to take much more notice of them than us simple clinicians who are actually out in there in the trenches doing the work.
I'll take that as an observation rather than a question, John, but the truth is I think that whether it's in the medico-legal sphere or most other spheres, that there tends to be a preference for people who are currently in practice at the time.
And my last question is about donations. Like, I'm very pleased to see that we give so much to cerebral palsy research, because that has cost the Medical Defence Union umpteen millions of dollars in my lifetime, where the obstetricians are blamed for everything that goes wrong. But this now giving lots of scholarships and things to undergraduates and everything, is this part of a public relations campaign to get people to belong to the Avant when they graduate?
That'd be a very pleasant unintended consequence. However, that you see the things that we do support all have an intrinsic nobility about them. There was a National Disability Insurance Scheme when it was generating that we supported it, and we supported the cerebral palsy stuff on the basis that there was an essential inequity in the system, that there could be two people in here with cerebral palsy with identical problems. One of them might get support by successfully suing an obstetrician. The other, the family, are imprisoned without any help at all beyond welfare. So that was the motivation beyond it.
I congratulate you on doing that, because when I was on the college council back in the 80s and involved with the AMA, we were trying to get this sort of insurance going, but it just didn't float in those days, and a lot of work was put into it by AMA members and members of this society.
Yeah. No, we think it's a lovely program. We're also very proud of the scholarships at the other end of the spectrum for young doctors, because more and more now a young doctor to get on a training requires a research project to get a job as a consultant or enter the academic field, and they don't get much help from anywhere else. All right, thank you, John. Thank you for that. Any other observations or questions? Well, I thank you all for that. I now move upon to the next item on the agenda, the election of voting directors. I confirm that the election of the voting member directors of Avant Mutual has been conducted pursuant to the procedure for the election adopted by the Avant Mutual Board. This year's election consulting group has again assisted us in the postal and online voting process, and we thank you, as I did earlier, for your assistance. Ernst & Young have acted as our scrutineers, and thank you again. We also thank them. We also note that the election voting closed at 5:30 p.m. on the 19th of November. This year, Dr Beverly Rowbotham and Professor Simon Wilcox are required to retire by rotation at the end of this meeting, meaning that there are 2 positions to be filled on the board at this election. The geographical requirements of the Avant Mutual Constitution are that at least 1, but no more than 3 voting member directors must be resident in each Victoria, New South Wales and Queensland. This means that this year, given our current board composition, a candidate from Queensland must be appointed, and no candidate from Victoria may be appointed, as there are already 3 voting member directors from Victoria serving on the board. Each of the voting member directors will be appointed for a 3-year term. At this time, I would like to ask Mr Craig Jackson to confirm that the election and the count have been conducted in accordance with the relevant rules. Craig.
Yes, Chairman, I do confirm that the count and the election was conducted in accordance with the relevant rules, and there were no exceptions from the procedures that we undertook.
Thank you. This year, we had 5 voting members put themselves forward as candidates, and I thank each of them for doing so. And this year, 2,207 voting members exercised their important right to elect their mutual board members. I've been provided with a report of the outcome of the election by Susan Barron on my left, our Group Company Secretary. The number of votes received by each candidate in order of appearance on the ballot paper were Dr David Alcorn, 501 votes. Dr Kirsten Price, 501 votes. Dr John Ullman, 487 votes. Professor Simon Wilcox, 1,350 votes. And Dr Beverly Rowbotham, 1,350 votes. Accordingly, I declare that Professor Simon Wilcox and Dr Beverly Rowbotham have been duly elected as directors for the Avant Mutual Group for the next 3 years. Congratulations, Simon, and congratulations, Beverly. Are there any questions from members about the conduct of the voting member director election? Therefore, it remains for me now to formally declare this meeting closed. And I'd like to invite those of you who are able to do so to take some refreshments, and I thank you all sincerely for your attendance and participation in this meeting. Thank you.